Hello, and thank you for tuning in to part one of this training series on DC perinatal employment leave. I'm Courtney Bernard, and I am an Equal Justice Works Fellow and attorney at the Health Justice Alliance Perinatal Legal Assistance and Wellbeing Project, also known as PLAW. As a reminder, we provide legal advice to your patients for issues that can affect their health. In this video, I will define some key terms and programs that are important to know in the event that your patients bring them up during appointments and that may lead you to fill out forms, write letters, or refer a legal issue for your patients to us. Our team might also reach out to you with health-related questions as we're helping patients navigate their rights and benefits related to employment leave. So let's get started. I will cover the three most common employment leave programs for people who work in DC. And I do want to emphasize that I'm talking about people who perform most or all of their work in DC, even if they live outside of DC. First, DC Paid Family Leave. This is a relatively new program run by the DC government that provides paid prenatal and parental leave for most people who work in DC. It also provides medical and caregiver paid leave, but I will focus on the parts of the program that are most relevant to our patients. Second, DC Family Medical Leave Act, or DC-FMLA. This is a district law that allows patients to take unpaid job-protected leave after the birth of a child only if they meet certain eligibility criteria. It also provides unpaid job-protected medical leave, which could provide additional days or weeks of job protection for patients who have medical complications related to their pregnancies. For this series, I will focus on the parental leave aspect of the law. Third, employer-based leave. This depends on the employer and the length and type of employment the patient has. There could also be distinct employer-based policies that interact with DC Paid Family Leave or DC-FMLA and could involve sometimes complicated nuances with short-term disability, PTO, and sick leave. So it may be useful to pause and think about these programs in this way. At the top, we have DC Paid Family Leave. If a patient works in DC, there's a good chance they can receive paid leave benefits through that program. With DC FMLA, they might qualify for protection, but there are quite a few factors to consider. Finally, with employer-based leave, a patient could work for an employer with extra or additional leave benefits, but these can vary significantly or might not exist at all. Let's take a closer look at each of these programs and define some key terms. DC Paid Family Leave provides paid prenatal and parental leave for most patients who work in DC. It covers up to 90% of an employee's normal pay up to a set weekly maximum amount. Patients must apply through the DC Office of Paid Family Leave. There are two separate applications for prenatal and parental leave, and patients cannot submit their applications until a qualifying event has occurred. So let's look at each one individually. At the time of this recording, DC Paid Family Leave prenatal leave can be taken for up to 2 weeks worth of work after a pregnancy has been confirmed by a health provider and prior to the patient giving birth. The qualifying event is the confirmation of a pregnancy by a health provider and or the patient's first prenatal appointment. When patients apply for prenatal leave, they must include a medical certification form filled out by a health provider. We'll dig into that more in our next training video. Prenatal leave is taken in 1-day periods and can be taken intermittently or continuously. This is a common area for questions from patients. So let's break it down. In scenario 1, you have intermittent leave. This is the most common for prenatal leave and occurs when patients take leave in 1-day periods when they attend their regular prenatal checkup appointments or attend other medical appointments related to their pregnancy, such as blood transfusions for pregnant patients with sickle cell or nutrition appointments for patients with diabetes. In this case, the leave days are spread out, usually over several weeks or months. Of course, if a patient has a higher risk pregnancy, their appointments might be more frequent. In scenario two, we have continuous prenatal leave. This is less common, but some patients may need to take continuous prenatal leave where the 1 day periods are taken back to back or continuously. But there must be a medical necessity for patients to do this, and a patient's job duties may need to be taken into consideration when making this determination. For example, if a patient needs a surgical procedure during their pregnancy and then is ordered not to lift anything and to limit movement for a certain number of days, they may need to take back to back or continuous days of prenatal leave, especially if their job requires being on their feet all day and lifting. The Office of Paid Family Leave will generally defer to health providers who fill out the medical certification form, indicating that a patient cannot work due to receiving continuous treatment or following a specific medical care plan to care for their pregnancy. Because the need for additional appointments or treatment may arise at any point during a patient's pregnancy, the patient can provide updates to the Office of Paid Family Leave in the form of medical visit slips, visit summary documents, or letters from prenatal care providers, or an updated medical certification form. The rules here can be a little complex, so when in doubt, refer it out to PLaw. Now let's turn to parental leave. DC paid family leave, parental leave, at the time of this recording can be taken for up to 12 weeks in the 12 months following delivery. Like prenatal leave, it can be taken continuously or intermittently, but we typically see birthing parents take it continuously, at least for the weeks immediately following giving birth. Unlike prenatal leave, parental leave does not require a separate medical certification form. Instead, once the qualifying event occurs, that is, the patient gave birth, patients will have 30 days to complete the application and upload some form of proof of birth, such as the patient's hospital admission form from delivery or a certificate of live birth, to be eligible for this leave. Let's now turn to DC FMLA, or as we like to call it, the Pampers of Employment Leave. Why, you might ask? Well, just like people say Pampers to refer to any or all diapers, even though it's really a specific brand of diaper, FMLA sometimes gets used to refer to employment leave generally. But really, it's a very specific type of leave. DC FMLA is a law that provides up to 16 weeks of unpaid job-protected parental leave within 12 months of birth for eligible employees who work in DC. One thing to note is that there is also a federal law, FMLA, that provides protection at the federal level. So patients who work in Maryland and Virginia may be covered by that. But DC FMLA is more generous and has lower barriers than federal FMLA. There are some specific eligibility factors that employers and employees must meet to qualify for this protection. Patients will apply through their employer, and employers will be able to tell patients if they qualify and the procedures for applying, which will likely include having a health provider fill out a medical certification form. We'll discuss this further in part 2. The key with DC FMLA is that it is unpaid leave that provides proactive job protection. This means an employee generally cannot, or at least should not, be fired or demoted while on leave, unless an employer has a reduction in staff that is unrelated to the individual employee taking leave. DC FMLA job protection is stronger than general retaliation protections. All to say, when a patient is eligible for DC FMLA, they should absolutely apply, and it can run concurrently with things like DC paid family leave and or employer-based leave. Which brings us to our final type of leave we'll be talking about, employer-based leave, which can vary significantly. For many patients who work in DC, the only protections and benefits available to them will be through DC paid family leave and possibly DC FMLA. But for some patients, their employers may have benefits that complement or expand on the benefits provided by these two programs. You can see 3 common terms that you may hear patients bring up as they relate to employer-based leave benefits. Short-term disability could provide income replacement when employees cannot work due to a medical condition or disability. And in this case, pregnancy and medical conditions related to pregnancy would be considered a disability. Employers may require additional short-term disability forms for a patient to take paid prenatal or parental leave at their full pay rate, but this is more commonly seen in conjunction with parental leave. As a reminder, DC paid family leave provides up to 90% of an employee's normal pay, so short-term disability could be available to help fill the gap in pay while an employee is on leave. Paid time off, or PTO, could be offered annually or accrued based on some employers. Sometimes employers will require employees to exhaust PTO when they go on leave, or this might be an option for employees to extend their leave time and receive pay. Finally, paid sick leave is something that many employees in DC qualify for under DC law, and this could provide a leave option during the perinatal period. Supporting documentation for taking sick leave may be required depending on the employer. Employers should provide their employees with detailed explanations of their leave options and benefits, including in an employee handbook. You can encourage patients to consult their employee handbook or to ask their supervisors or HR departments for leave policies. And of course, refer to P-Law if you suspect that your patient could be facing a legal issue. We hope this video helped clarify some of the key terms and nuances with employment leave benefits and programs for patients who work in DC. When a patient faces a legal issue related to employment leave, please refer them to P-Law. We are here to help your patients. Thank you for tuning in. Please use the QR code on the screen to take the survey to ensure you get credit for watching this video. And please watch part 2 for a deeper dive into medical forms and employment leave. Thank you.